I was diagnosed with testicular cancer. At the time, I was on my wife's insurance plan, Blue Cross Blue Shield. Yeah, it's a pretty good plan. Went through had to immediately go into 3 months of intense chemotherapy. My wife then left her job, and I was left in a position to where the insurance was going away, so we transferred over to COBRA. For me, the Affordable Care Act came at the most opportune time so that I could actually still get coverage. Late November, looked up plans and immediately found plans that allowed me to keep my same coverage, so I could stay with Blue Cross Blue Shield, who was my provider before, which meant I wasn't going to worry about changing doctors or anything like that. Then I immediately also saw that I took one of the best plans you could get, so the gold option. And even with the gold option, staying with my provider, my premiums went down $200 a month. So, and of course, most importantly, I was able to actually have insurance, and that was my main concern, because after you've been diagnosed with cancer, your chance of getting any kind of insurance that's affordable, especially for self-employed, is so marginalized. The interesting thing about the healthcare.gov site, I'd heard a lot of horror stories beforehand, heard about the problems people had. I started a profile real fast, in early November, and the site was still being worked on, so I just returned 2 weeks later, and once I got in, logged in, everything was fine. It took me minutes to pull up the probably 20 plus plans that I saw, and I tell people it's literally as easy as using Netflix. I decided to share my story because I heard a lot of horror stories. I heard a lot of people saying how it wasn't going to work, and the Affordable Care Act was going to be a travesty. And so whenever I went in to actually log in and set the profile and get everything working, it was so simple. It was, and I saw an immediate reduction in my premiums. That to me, I felt it was compelling to let others know at that point, because again, there was so much misinformation going out. In Texas specifically, seeing so many people uninsured, and now having this option has been such a breath of fresh air. It allows you to live a little bit more freely, so you can actually pursue the work that you want to pursue. Those of us who would definitely have been marginalized by the way things were prior to the Affordable Care Act need to get that message out there.